नमस्कार दोस्तों, मेरा नाम डॉक्टर प्रशांत माखीजा है। मैं वोकहार्ट हॉस्पिटल मुंबई सेंट्रल में कंसल्टेंट न्यूरोलॉजिस्ट हूँ और आज हम बात करने जा रहे हैं माइग्रेन के बारे में और उससे रिलेटेड मिथ्स या भ्रांतियों के बारे में हम डिस्कस करेंगे। Migraine has specifically defined criterias. Usually, migraine patients will complain of a throbbing or pulsatile headache, which most of the time starts from one part of the brain, but patients may have alternating side during different episodes. The migraine headache episode can last anywhere from 4 hours and it may continue up to 3 days also. Many of these patients may also complain of nausea or they may vomit also. In addition to that, they may have intolerance to light and sound. So these are the usual typical features of migraine. And when many of these patients, before the headache starts, sometimes they may have some aura, which most of the time is in the form of visual aura. They may find it difficult to see in one part of the hemisphere, and subsequently that visual symptoms subside and then headache starts building up. So this is how a typical attack of migraine occurs. So there are multiple triggers of migraine and they can vary from person to person. The common triggers are if somebody hasn't had his or her meal for long, like जैसे कि breakfast skip कर दिया and they did not take their lunch also. So hunger of course can trigger an episode of migraine. Sometimes it is some kind of smell, strong smell, which could be a trigger, and certain food items can also precipitate an episode of migraine. In particular, cheese containing food items, processed foods, they are common triggers for migraine, and consuming red wine and certain dark chocolates, these are the common triggers. So migraine, of course, as we have seen in different studies, is roughly 3 times more common in women as compared to the men. Partly it may be because of the hormonal differences between the two genders. So whenever somebody is having migraine, we frequently see because over the counter painkillers are easily accessible, they start consuming painkillers on their own, and if they continue to do so for long, not only it can have detrimental side effects for the body, particularly many of these painkillers can be detrimental to the kidney. They can lead to kidney dysfunction over a period of time, and also if somebody consumes frequent painkillers, then we will see over a period of time that the same painkillers which were working very well for them initially are not working now. So there is some entity known as medication overuse headache, wherein if the person is consuming frequent painkillers, roughly 10 to 15 days a month, and if he or she continues to do so for at least 3 months, then they develop a complication of migraine. We call it as medication overuse headache. Therefore, it is always advisable that if somebody is having migraine, they should seek proper consultation from a neurologist and be treated under the supervision of a neurologist. Yeah, so we have seen that migraine is most commonly seen in adolescent or middle age group, and with good lifestyle over a period of time, usually the frequency and intensity of migraine reduces. So it is not that elderly do not have migraines, but it is comparatively less common in elderly compared to the young and middle age. Migraine is a definitive neurological disorder. It is not something psychological या मन से उत्पन्न होने वाली बीमारी. There is a definite pathophysiology which is involved in the genesis of headaches related to migraine. There are certain inflammatory neuropeptides which are released whenever a patient is having an episode of migraine. So it is scientifically established that migraine is a neurological disorder and it is not something psychosomatic or coming from your thinking or overthinking. So stress may be a trigger, but stress entirely is not the cause of migraine. Genetics is just a predisposition for migraine. So many of these migraine patients, they may have family members like their mother, sister, who may be having migraine episode, and that is how they are genetically predisposed to developing migraine themselves. So there is a genetic association, but to call it like migraine is a psychosomatic disorder, that is incorrect, because it has been clearly established that during the process of headaches happening in migraine, there are typical inflammatory neuropeptides released, which then trigger this episode of migraine. So, as I said, the migraine frequency intensity is variable from person to person and even within a person also from time to time. So if somebody is having frequent migraine episode, roughly one episode per week or about 4 or 5 episodes of disabling headaches per month, then it is advisable that they seek consultation from a neurologist and get themselves treated under the care of a neurologist rather than self medicating themselves. Of course, lifestyle intervention can surely help in reducing the frequency and intensity. The simple things are like if you know your triggers, then it is best to avoid them as far as possible. Having good hydration is also good for migraine, and of course, having a proper sleep also ensures that your frequency intensity is less. And talking about non-medical treatment, now there are certain neuromodulation devices which have come up, which you can say somebody can wear it something like an armband, and then it is sort of monitored through a application which is cell phone based. So there is some non medicinal treatment also available for the migraine. These are neuromodulation devices. Thank you.